talk about health, when we talk about especially disease, you have a problem, you go to the hospital or you go to the doctor, we usually talk about the disease and the solution, whether it's a chemotherapy or medicine or whatever. But each of you are an example of how everything we do is much more than those two things. So I thought I'll have a bit of conversation with each of you about what's beyond the four walls of the hospital or the treatment center that really brings wellness into this world. Dr. Raghu, I'm going to start with you. You returned to India. Basically, your mother was diagnosed with breast cancer, so you came back to take care of her, and that led to establishing, she not only recovered, but it led for you to establish one of the most successful breast centers in the world, actually, and for which you got a Padma Shri as well. So, a great honor. And so you have an interesting theory of, there's one room in your center that's the most important room. So tell us about that room.
Thank you very much, Lakshmi. Yes, I did come back with a passion to serve my motherland when my mother was diagnosed with breast cancer. And one of the things when my mother said, when she was diagnosed with breast cancer, when I was working in the UK, is whatever you do when you come back home, you ensure that counseling is given utmost importance, because she was counseled, and she is a gynecologist and she has been treating patients all her life in India. In India, counseling is not part of our medical curriculum. And she said that the comfort, the inner strength that she got because of being counseled by the breast care nurse in the United Kingdom was something that has given her a lot of strength to deal with the disease. So one of the first things that I do when I see a patient, which I think is my duty, is to be able to counsel the patient, talk to the patient, and before talking, listen to the patient. Because as a doctor, as Hippocrates said many thousands of years ago, you can cure sometimes, you can treat often, but it's important to comfort the patient always. So when somebody is told that they have breast cancer, there is a veil in front of the patient and the doctor, and it is the duty of the doctor to comfort the patient in a way that will reassure the patient, to relieve the anxiety, the fears associated, and equally provide that inner strength that is required to fight the disease. I'm not doing any favors by counseling. In fact, it is my duty, and I take that very seriously, and that is uppermost in my mind when I first break the diagnosis of breast cancer to the patient.
Yeah. So, Ananda, you were one of the patients he's referring to, and if anybody knows Ananda, she's not an easy person. She's very strong, has her opinions, and she wants to do what she does. She's an amazing dancer, Padma Shri from Hyderabad. So, and also is in the Indian Railway Services as a side job. No, and so Ananda, tell us a little bit about when you first found out. Actually, you gave a great TED talk for me in Mysore about dancing your way out of cancer. So when you first found out, you actually worked with Dr. Raghu. So tell me, what was your experience?
Thanks, Lakshmi, for having all of us here. Thanks for all of you being here. Yes, the first time you hear the word carcinoma or cancer can be, as you said, more than a wail. It can be like a thunderbolt. And as I've always said, we as dancers know the 9 emotions. We act the 9 emotions, but when you hear the word cancer, you know and understand and experience one emotion, that is fear. But with the counseling that started from the very moment I met Dr. Raghuram, I transitioned from weepiness, frustration, anger, fear, to a state of being able to deal with this, with this thunderbolt. Also, because I'm a dancer, I have this inner core strength, I call it, a passion. Most of us are trained to be core competent as innovators and entrepreneurs, but very rarely are we trained to have core strengths. And I make a distinction, and my core strength has been my dance. So when I heard the word carcinoma,